Good afternoon, everyone, and welcome to our breakout session on community-based dental assistant training programs, overcoming workforce challenges. We're glad that you decided to join this session this afternoon. I am Shade Cronan. I'm the Foundation Director here at Zufall Health, and we've got some wonderful panelists joining us this afternoon. First, I just want to remind you of a couple of housekeeping items just to navigate the session. Remember that you are muted. You can raise your hand or you can type a message in the chat. To ask a speaker a question, please use the Q&A window. Questions will be addressed. For this one, we'll actually address them as we go through the presentation, and hopefully we'll have some good questions from you in the audience. If you'd like to receive CE credit for this session, please do complete the survey that will be shared in the chat towards the end of the session. If you miss that survey, links will also be emailed to all of the attendees. And when the session ends, you will be automatically routed back to the library where you can choose our wrap-up session that will be the final session of the day. So I just want to review our learning objectives that we hope that you will get out of this session. So first, in the following panel discussion, we hope that you will be able to describe factors affecting the dental assistant workforce shortage. We hope that you'll recognize the elements of starting a dental assistant training program, and that you'll be able to analyze the challenges and opportunities for sustaining a dental assistant training program. As I said, we've got some wonderful panelists today. Joining us, we have Dr. Ron Deblinger. Dr. Deblinger, welcome. Dr. Deblinger is the chairman of Delta Dental's Board of Trustees and is also the current acting chairman for the Delta Dental of New Jersey Foundation. We also have Dr. Nicole McGrath-Barnes. She is the founder and chief executive officer of the KinderSmile Foundation. And we have Dr. Isaac Zeckel. He is the chief dental officer of HealthLinc Community Health Centers in Northern Indiana. So welcome to all of you. We're going to begin our discussion today, and just for the audience to know, we're not sharing any PowerPoints for this session. This will be a panelist discussion for the whole time. Again, we've got a list of questions that we'll begin with, but please do feel free to enter questions into the Q&A. We'd love to incorporate those into our discussion today. So to begin, and this is a question for each of our panelists, I'm going to just begin to ask you to each please talk about the need for dental assistant training program at this time. Why do you think this is an important issue? Why did we include that today? And as we go around, I'll just ask you to add any other bio information about you or your organization that you'd like to. So Dr. McGrath, why don't we start with you?
Okay, great. Good afternoon, everyone. And it's a pleasure to be here to discuss, I feel, one of the most important workforce, especially during COVID. We lost quite a few dental assistants, hygienists, and even dentists during COVID. So there's definitely a need to bring back the interest of the dental profession and to increase the workforce. Currently, we have 3 dental homes located in North and South Jersey. And I know we have experienced an increased shortage of dental assistants, or just dental assistants, individuals not interested in the profession as it was. So very crucially important, and especially the fact that we're in marginalized communities, we want to increase that workforce. We want to be a present, not only access to care, but mentoring those to come back into the profession.
Thank you. Dr. Zeckel, we'll go to you next.
Sure. Just like Dr. McGrath, we had lost a number of dental assistants. So at our health center, we have 5 locations in Northwest Indiana. Those are dental specific. We have more medical groups, but we have 15 positions open for dental assistants. And we didn't lose anybody in 2019. We lost 7 in 21, and then 7 in 20, and then 12 and 21. So we had a very large amount of turnover that we've never had before. We've never had that kind of turnover in any of our dental positions. And part of what the turnover was is that when we would hire people, we really having trouble because the people that we were hiring were basically learning on the job anyway. So we would be ready to go and realize that, oh, we have to take a couple steps back because the staff that were trained as dental assistants that we were hiring, we could attract, just weren't ready. And the ones that were, we weren't really getting any applications for dental positions with people with experience. So we really struggled with that. And it really was devastating to my dentist productivity. Dental assistants keep everything going, and it's so critical to have people that are really mission driven and responsive to getting done what needs to get done. So it's super important to us.
Thank you. And Dr. Deblinger, you may have a little bit of a different perspective, but share with us, please, your thoughts on, why is this an important issue? Why is Delta Dental interested too? Oh, you're muted, Dr. Deblinger.
It all stems back to access to care. And as was stated, by both Dr. McGrath-Barnes and Dr. Zeckel, it's such an issue. I practiced for 40 years. And yes, we used to train our staff right from the get-go, 16 years old and whatever it is. And I've had many that went on to become dentists. So you have to try and present the positives of this profession. It's a wonderful profession for people to get into. It is not a dead-end place. So what we're trying to do with Delta is understand how can we help dentists and through them, how can we help patients? So we had 4 different pillars for our foundation to donate money to. And one was children, one was seniors, disabled, and veterans. And we're adding a 5th, and it was this year and next year moving forward, is workforce issues facing dentists. And how do we go about that? Well, there are programs. We funded a program at Zufall to try and how do we train? There's obstacles for dental assistants to get into to our offices. As you said, they weren't trained. Why? Maybe there are issues with how many hours they have to work before they get their license, before they get their x-ray license. I mean, we all know as dentists that we can train them in a much more efficient manner. I understand that government has to control these things, but what we want to do is work with all parties to try and help get more people interested in dentistry, interested in dental assisting, dental hygiene, and we're also programming. We're looking for small donations, or we make small donations, or larger ones to promote these programs. And I can get into it more if you really want me to. But the key is we have to get them interested and why it's such a great field to get into.
Right.
Go ahead, Dr. McGrath.
Yeah, okay. I know that, one of our biggest hurdles is that we're a community health center. We are specific in marginalized communities to increase access to care for low-income children and families. And unfortunately, with KinderSmile, we don't get donation or funding from the federal government. So we rely on one of our favorite donors, which is Delta Dental.
And we love you. We love you too.
Yeah. We have been in existence for 15 years, literally this year, and Delta Dental has supported us the entire journey. But what we notice is that we cannot compete with the private sector salaries, with dental assistants, dental hygienists, and even dentists. And I'm afraid that we're going to lose some great people to practice and to want to become dental assistants, hygienists, and dentists in the marginalized communities. We're competing with, DSO and private practices. And yes, we understand that students graduate with, in debt, and even with the dental assistant program. A lot of the non-accredited and the accredited dental assistant programs, they have to pay tuition to attend these and to train. But what we're finding out, unfortunately, they're not they don't have the basic rudimentary to start in, in a practice. So it's twofold. We don't want to lose them in the communities that really, really need them. So we're doing our best to partner with Mercer County Community College and has established a dental assistant program there. So yes, I wanted to just mention that.
And Nicole, you're absolutely right. And, we do love you. You guys do an amazing job. We give scholarships at the schools to students. We go into Central High School in Newark. We go into the Bloomfield Health Center. We want more of those. And one of the things that we're trying to do is, Zufall, there are programs that really know what they're doing with this. And how about getting them together, just like this type of forum, so that they best practices. We don't have to keep reinventing the wheel. I wish we had more money to give away, and we probably will be. I don't want to get the cat out of the hat yet, but the fact of the matter is that we can only fund $1 in $5 that are asked, and that's heartbreaking. How do you say no to disabled children? How do you say no to underprivileged? It's just very, very hard. But you're absolutely right. We want to, and other national organizations, our national Delta Dental program is actually looking at these kind of things, how to promote more dental assistants and more hygienists. And the thing that you bring up is how do you compete salary-wise is a very interesting one. I wrote that down.
And Dr. Deblinger, you led very well into our first question that's in the Q&A, which is, as a dental profession, how can we market the role, responsibilities, and benefits of being a dental assistant? Who should our target population be? You mentioned a few spots of some of the high schools. Where else, and any of you, feel free to jump in. Where else should we be marketing this to? Who should we be targeting this to?
What about the people who left jobs, who don't want the rat race of, who just want a second career? I think that there are a lot of people who want to work within their community, who don't want to have to travel, who don't want to go into the big buildings necessarily. And we can actually, if we can, train them, get them interested, and bring them into the dental community. So I think we can target, retired people, semi-retired people, all of a second job.
And we've found, we do an on-the-job training program as well, and we haven't been doing it a long time, but we've had two classes go through, and we did very little advertising, if you will. But in the second cohort, we had 56 applicants for 6 positions, and we only had it open for 2 weeks. So there's a number of people that are really interested in doing this, and I think from a marketing standpoint, that it's not just the dental assistant, you're not assisting the dentist, the dental assistants, if we're honest, they really run the office. And if they're not there, the dentists are having a bad day. And it's also an entry point. A lot of them would be, like service reps for medical offices, or, service reps for, working in the service industry. A lot of those folks really want something different, I think. And dental assistants, at least in our state, you can start as a dental assistant, but there's multiple levels that you can move up to expand and really be, placing fillings and doing things that are more advanced. And I think there's a lot of opportunity for that. And, it can kind of be fun.
Absolutely. No, I know with us, how we have probably close to 200 community partners throughout the state of New Jersey. And we send out flyers to them if we're in the process of hiring, whether it's United Way or Big Brother. You never know, just like Dr. Deblinger said, they might be interested in changing their career and their profession. So that's pretty much how we try to attract or get more interest and also Trenton High School and other community service learning programs that are out there who we are partnership with as well. Just try to go and present to them, whether during COVID, it was in Zoom or going in person, to let them know that this is a wonderful profession. And I myself grew up in Brooklyn, New York, and I started out as a dental assistant, and my mentor was outstanding. And that was really my pathway to this incredible profession. So I share my story as, you know, as a Black woman in this profession. I like to share my story when I'm speaking to the high schoolers and the other community constituencies about my journey, my story, and how I ended here.
Absolutely. It's great
I know you're gonna be surprised. I also started as a dental assistant. I worked as a dental assistant while I was, in college.
Yes.
And then eventually went to dental school and worked in the Head Start program on Saturdays. So, it is, and you have to have the ability to get out there to share the fact that you're independent. It's the same thing. I can't tell you enough how satisfying it is to work with kids. I know in your area, to working with any dental patients at the end of the day. So I think that, but we need an organization to kind of coalesce everything around it. And we're working on it. We're trying.
Have any of you had experience? We had another question come in about recruiting candidates from your patient base, from any of the folks that you are serving. Has that been a resource for hiring?
Absolutely. In Trenton, which is our most recent dental home, and we've expanded our services not only for children, but for adults there, because there's such a need there in Trenton. And I would probably say about 50% of our patients are bilingual. It's a Black and brown community. And we always want to be culturally sensitive. So we have asked our Spanish-speaking patients, hey, are you working? Do you want to pick up a couple of hours? And we have actually, we've actually hired two. So
that's great. I'm going to jump around a little bit in the questions here, but Dr. Zeckel, one came in directed to your previous comment. Were the training positions posted just through normal job posting methods, or did you do something special to promote the opportunity?
Well, I think so we have other training. So we have medical assistant trainings, and other, basically staff support building. So they do go out like to the high schools, just like what the others were talking about. And I do believe they posted it on some job searches, but also we like others were saying, we also marketed internally, and we had a number of internal candidates. Most of them are front desk folks. But that's kind of a stepping stone as far as the ladder goes when they come to HealthLinc.
That's great. Another question for all, and I don't know who may be best positioned to answer this, but a question came in about, are there any plans to help foreign dentists get their license in the US and work for underserved communities? Anyone can speak to that?
Yeah, we've had a couple of interest from foreign dentists, and I know that you have to go, there's legal protocols being sponsored. I think it's the H-1B one, or if I'm not mistaken, visa and so forth. But we're amenable to that. We want to attract dentists of all sorts to provide services in the marginalized community. It is the most rewarding thing, I think, profession to be able to give back and give quality comprehensive dental services to the marginalized. So we have maybe about 5 dentists who are interested, but it's a lengthy process, legal process that you have to go through, but we are amenable to hiring international.
And I know some of our.
I think that Rutgers has a program. I think that University of Pennsylvania has a program, and I think that NYU has a program. Again, very expensive programs, very lengthy, but they do have means to become dentists in the United States. But I know dentists who are foreign dentists who went into practices to do lab work, and they don't need that license.
And I know our colleagues from the state of New Jersey, the Department of Health, were talking about a program with, I believe it was J visas this morning. So that's another resource if we want to, you could circle back to them. Dr. Taiwo had addressed that. We're getting some good questions coming in, so I'm going to move on to the next one. I am at an FQHC with 3 dental locations, but our primary service is medical primary care. Our CEO, who has no dental experience, is adamant that we only hire dental assistants with experience, which we simply don't get applications for, usually because we cannot compete with pay. What are some suggestions to make the case that we can't survive without dental assistants and on-the-job training is a necessity?
From my perspective, there's really good resources out there about efficiency with the dentist. It shows how many offices or dental operatories you have and how many dental assistants you have, and it's just a math problem. You can say, well, if I have staff, if I have 1 dental assistant, I can do 9 patients a day. If I have 2, I can do 18 patients a day. I think I found the best way. It's just a straight math problem from a kind of a benchmark. And Safety Net Solutions used to have one. I believe D4 now is kind of took over for that. But if you search that, they should have that part of marketing. And I think the part that's really difficult to convey to people that, a dental assistant that's good, I feel a lot better at the end of the day. I could see 18, 20 people a day and feel like it wasn't a big deal. If I have struggle with each step along the way, I could see 9 people and be exhausted. So it makes a huge difference in retention, just even for the dentist too.
Absolutely. There was a comment in the chat relative to that you can teach knowledge necessary, but it's hard to give someone that passion, and sometimes those with less experience, if they have that mission focus and that passion, will be some of your best employees with training. We had another question about how do you train someone to take dental radiographs in your office?
That's simple to do, but the state won't let you. I mean, you have to have X number of hours. We've toyed with the idea, I know from Zufall about being able to sponsor a program. In other words, if you have a dental assistant who you really feel can go places in your office but doesn't have an X-ray license, maybe we can give some type of scholarship money for that person to get their X-ray license. And we still want to explore that. I think that helping each individual, and again, it's that helping in the office, and they become so much more functional. So yeah, you can train them. It's simple. We did it all the time. I'm showing my age now, but we really did. I came in, you didn't need an X-ray license, but now you do. I guess it's just, it has to be the safety and your patients, but quite frankly, not a fan.
Well, and Zufall is going through that process now, and I will say it is an intensive process to get approval from the Department of Environmental Protection to get the accreditation and approval to be able to do that. Zufall has decided it is worth it for us to make that investment. We have support from Delta Dental Foundation as well to help give those scholarships to the students, et cetera. But it is a process to learn how to do that. But I think as the conversation today, the shortage, we need to train more of our own dental assistants, and one of my first high school jobs was as a dental assistant as well. So I didn't pursue the same path that you all did, but I obviously didn't have a license at that time, but I did learn how to do it. So times have changed. We need to follow those rules today.
Can I just, one other thing, I was remiss. We also are part of Connecticut. So if there's any people on this program from Connecticut, anything I say from New Jersey applies to Connecticut also.
Thank you. And someone just brought in a comment that some local colleges, this person is coming from Virginia, so again, just to give some context for other parts around the country, offer one-day virtual X-ray certification classes to meet state requirements, which allows legal on-hands training in office. So again, an important point though is we have participants from across the country. Your state laws and requirements may differ. Dr. Zeckel, I don't know if there's anything different for you in Indiana.
Yeah, ours, we are able to provide a provisional permit for our students, and they have to pass the licensing exam at the end. They are supervised by one of our dentists. So yeah, every state's different as far as what they require. It doesn't help that our border state, well, Illinois doesn't require a specific license, so anybody that would cross over from Illinois didn't really meet our requirements. So it's always a barrier.
Absolutely. Another question that came in the Q&A, prior to becoming the dental practice manager at RFQHC, I was a dental hygiene and dental assistant educator for 22 years, recruiting in the same city as the college. I find that the dental hygienists and dental assistants want to go out to the glamour of corporate offices. Dr. McGrath is nodding her head. We do train our own dental assistants, so that has a benefit to us, and we advertise for trained and OTJ candidates as well. Any thoughts on that? How do we compete with other types of practices and convince folks that the underserved communities that we work with are wonderful to work in?
I think for us, a couple of things. We do offer to pay our dental assistants to take a course, a radiology course, at one of our community partners as an incentive to get your radiology license and so forth. So we've learned to implement that in our workforce. I think once they do come and work in a community health center or in marginalized communities, it's so rewarding. I think it becomes infectious, and that they realize that serving the underserved can be more rewarding than monetary, gain. So I always implore people to come, see what we do, shadow us, know that you're pouring into a community that has been forgotten for so long, and given back to the community. And they do end up staying. But we also do lose those who, maybe we're paying $19, $20, and they can go someplace else and get $26, $27, or some hygienists are paid $65, $70 an hour. So it's still hard for us to do that because of our restricted budget. So we just do our best by mentoring them.
And it's not just you. I mean, I hear that all the time. We still have some solo practitioners in the state, and they can't hire anyone. If they can hire them, they can't afford to pay them.
Mm-hmm, mm-hmm.
And I think for us, we really, well, the environment that we try and create is that makes it really difficult to leave. So like we try and, we are all the staff really get along well. It's like kind of like your family. They hang out outside of work. So it by building those kinds of relationships at work, by having fun and getting your work done, but also having fun, it makes it, that 50 cents an hour or $1 an hour, it's like, well, okay, the math, does that work out? If I'm going to leave my friends to go to someplace I don't know. So I think that's a part of the compensation, not a compensation package, but it's just part of working at a health center where, oftentimes, at least at our health center, a lot of them are all about the same age. We all kind of going through those life transitions. We're all having kids and struggles with that. I think that all kind of builds that rapport that helps keep some of the dollars and cents. Obviously people have to have a living, and they need to be able to support their families and, take care of the people that they know in their communities.
Absolutely. Somebody else put into the chat just suggestions that, are there full-time opportunities for dental assistants or only part-time? Could dental assistants be attracted by other benefits such as vision or dental benefits even if they were part-time. So any other thoughts about, other creative approaches to different types of compensation than we talked about? Bear with me one second.
I know with us, we do a lot of CE courses for dental assistant, dental hygienist, dentist free, and just exactly what Dr. Zeckel said, just making the environment team players, just going out bowling or to the zoo, bring your child to, and just that camaraderie in the dental home and outside does make it more attractive.
We
Absolutely.
buy donuts and coffee. That's usually what works.
Yes, and pizza,
Pizza.
Chick-fil-A,
all
anything.
the healthy foods, right?
All the
Yeah.
above,
Good.
right?
Candy drawer doesn't hurt.
Right. One of our participants asked, do you have a curriculum for training your dental assistants? Is that something that you've developed in your programs? And could you talk a little bit about what that looks like?
I can just kind of give an overview of what we do. So our on-the-job training involves Mondays and Fridays. We have a little mock training room, and we have a dental assistant trainer that kind of puts on these, and they work through the bookwork as well as all right, this is how you do an Alginate impression. This is how you pour them up. This is X, Y, or Z. And so they are working with that with their group of students for those 2 days, and then the middle of the week, the Tuesday, Wednesday, Thursday, they're in their respective offices where they're helping the staff dentists and dental assistants and hygienists get through the day. So they turn the rooms over, and as they learn this different procedures like restorative, surgery, crown, endo, as they build that in the classroom, they are then able to step in and take over and work with a preceptor at each office. So the idea is that we were really hurting there for a while in 21, and the idea is that they may not be able to help the procedures right at the beginning, but they could turn the chairs over. They could clean up the rooms, and so the people that were more experienced could move on to the next patient.
Absolutely.
Ours is similar, but a little different. We have the didactic and then we have the clinical. This is our second year. The first year, we would do the didactic in sort of a classroom setting with a monitor and whiteboard. And we noticed that we were just losing interest. It wasn't stimulating enough. They were learning about dental, but they're looking out the window and so forth. So this year we decided to do the didactic downstairs in our dental home, where the chief dental provider, Dr. Stephen Vassell, who teaches that course. He will then, if he's talking about a setup, a mirror and explorer, or they're reading a chapter from the book, they can turn and say, oh, there it is. So it's more stimulating doing it in the dental home where they're surrounded by the dental armamentarium and the equipment. Most of our students are working single moms, so it's an evening course. So they have a didactic schedule throughout the week that they have to read so many chapters in the particular book or manual, and then we meet twice a week in the dental home to review that and to keep reinforcing the clinical every single time, keep reinforcing the setups and the different procedures, the different subspecialties and so forth.
Excellent, thank you. What beyond the curriculum, and you've both touched on this a little bit, but what are the other sort of key elements that you think a dental assistant training program needs to have to be successful?
So for me, I think to really be successful, I think you need to have your team on board, and you have to have. I really believe in our model that you have to have somebody, a dental assistant with it that has experience, that's willing to show them and really kind of mentor them and guide them. not
Mhm.
necessarily just say, watch while I'm doing it. I say, no, you do it and I'll watch. I'll make sure that you're doing it right. And if you have questions, I'm here to help you, but I'm not here to let you watch. People
Mm.
struggle to learn when they're watching. So I think that's really critical. The other really, if anybody out in the 56 participants out there that are thinking about doing this, I think it's really critical that you consider having checkpoints along your program. There's going to be some folks it just doesn't click with, and that may not be a good fit. And I think that having checkpoints along the way, where you can kind of have a real honest conversation with your students and say, hey, this, really struggling here. This stuff is really important. And if we can't get this going, then we need to part ways. But I think, we really want to support you and recognize that it's not always people's, there's the knowledge, and then there's the moving your body, positioning, there's a lot of different aspects to dentistry that aren't just, okay, follow how to Excel spreadsheet, all that stuff.
Right.
It's different skill sets. So I think it's really important to have checkpoints along your program.
Absolutely. Dr. McGrath-Barnes, any other?
Yeah, and I agree with you. Dr. Zeckel. I think also what made it's making our program successful is the preceptor or the instructor is a dentist. So he's speaking from, his expectations.
He or she.
He or she, yes, he or she.
Come on.
Specifically talking about yes, he or she, from his or her perspective as a dentist, the expectations, some of the challenges. I think we're feeling that the students are responding a little more when the instructor is a dentist. And also just tactile. As you read a chapter in the book, then you immediately go and touch and feel and see, go through different runs. New patient comes in. Okay, so we read about this. Now, what would you do in this situation? And they sort of, learn through interaction and touching and feeling. We're feeling that we're getting a lot better responses from the dental students than prior year when we did things a little differently.
Excellent. Dr. Deblinger, from the funder's perspective, how would you define success for a dental assistant program that you helped to fund?
Good question, but I think part of that is that your percentage of enrollees actually go to work in dental offices and continue in the dental field. We've been funding a certain program in two of the high schools, in Central again and in Bloomfield. And, we get reports on, how many of those students that started the program finished the program and went to work in dental offices. And then did any of them go on to become hygienists? Did any of them go on to become dentists? And that was what we considered, a real success, because in our office, we had, as I say, many students who started out while part-time in high school, worked to become hygienists, and then went to dental school. And matter of fact, one of the dentists that worked in our office as an assistant actually bought my friend's practice. So that was really cool. That was the full circle. So, I just think that it's just bigger. It's a bigger problem. And we were first starting to focus on it. Where's the ADA? And, there are other organizations. Now we're really trying to look at partnering with other healthcare philanthropists, let's call it, in New Jersey and Connecticut to see if we can match funds. We do a lot of matching funds now. And it's just such a large issue that we really need the help of smarter people than me to really go into this thing.
Thank you.
And I think one of the ways too, Shay, to how you, the metrics or measure is just as Dr. Deblinger said, they start out as dental assistant. They're so passionate about what they're doing. and they become hygienists and then move on to dental school. And we've had some great successes over the last 15 years. That's it. That's you know that you're impacting your employees when they start to move up the rung of the ladder.
Absolutely. We had a question in the chat, and this was partially addressed by you, Dr. McGrath-Barnes, but and Dr. Zeckel, maybe you have a different model, but who are the trainers? How are the trainers trained? Just based off of their own experience? Do they have teaching experience? And Dr. McGrath-Barnes, are they always dentists for you? You found that's most effective? Are they ever other dental assistants? And then Dr. Zeckel, we can go to you as well and see what your thoughts are.
So this is our second year partnering with Mercer County Community College. And the first year it was a combination of a dentist and a hygienist. They would sort of swap back, and just doing post-assessment and feedback, the students were more responsive to getting the information from the dentist, so to speak. So yes, we've had a dental hygienist teach the course before. Not that there was anything against that particular person, but for some reason they're thinking, well, I'm going to be hired by a dentist. I want to hear from this dentist, he or she. So we just started to continue on the same trajectory for the second year. But we do bring in some of our dental assistants the latter part of the course. Maybe 3 months before they graduate, just so that they can shadow them and they get some information from the dental assistant. So we sort of mix it up, because the dental assistant's going to be interacting with the dentist, the dental hygienist, and the desk. We definitely try to mix it up, what their interaction with each of the.
Thank you. Dr.
Yes.
Zeckel, how about for your program?
So we just really lucked out. We had a dental assistant that had numerous years of experience respond to our educator opening, and she actually was, it couldn't have been a better fit, but we're really lucky. But she was doing dental assistant training at another organization, and was looking for something a little more fulfilling, I guess. And so she does the classroom, and she circulates to our 5 offices where the students are, and she interacts with their preceptors and the dentists that are working with them, and just getting feedback, and then circles back and touches base with any areas that they may have. So she's kind of the lead on this program, and she should be talking to you guys, but they got me instead. So, but it's, I hadn't considered the part about the dentist, leading it. I could definitely see that perspective as well.
Excellent, thank you. We had another question in the Q&A asking all of you as dentists, what is most helpful for you from a support perspective when you're working with or training new assistants?
Passion. I mean, the fact that they love people, because boy, it's just such a people to people profession. So to me, we can train them to do anything in the offices. It's a question of, do they have the real passion to be with people and help people?
And I think for us, I hope that I'm answering the question. I think for us, especially working in marginalized communities, having, compassion and empathy is crucial.
Totally 100% agree. If we get a dental assistant that doesn't have any empathy with some of the patients do unexpected things, and it's not our job to know why, but there's more to things going on. So I think if you have a dental assistant, or even any staff member, to be quite honest, they're not going to work out. They're just not going to work out. And I think another part, if I were Am I perfect? The dental assistant is somebody that, we can have fun while we're doing work, interact, give me a hard time. Like, that's great. I'll give you a hard time. And then that makes the day go by. And even the patient, we like to give the patients a hard time too sometimes.
Mm-hmm. Excellent. Thank you all. Another question from the Q&A, and this maybe is for Dr. McGrath-Barnes and Dr. Deblinger in New Jersey, but are you aware of any other public dental assistant schools in New Jersey?
Yeah, there are quite a few. In Trenton, we partner with Mercer County Community College, but up north, we are partnering with a organization called Fit for Basic. And our partner, we allow the students and the preceptors to come a couple of Saturdays out of the month and use our dental facility, our dental home. But I think there's Fortis, is there Fortis Institute?
Mm-hmm.
Correct? I think there's also Essex County. There's a dental assistant program, Dr. Deblinger, in Essex County Community College. Am I correct?
Yes. And then there's also a for-profit organization, and I don't know the exact name of it, but I think it's in the Wayne area, so to speak. They have
Burden Institute. Someone just
yes. Yeah. So and again, we want to sponsor these things, and I'll just give a little plug that you can email me or email Ken Elmore. Can I give it now?
You can, absolutely.
KELMORE at deltadentalnj.com, or myself at rdeblinger, DEBLANGER at deltadentalnj.com.
And I'm just putting those into the chat so folks can see them.
I know Dr. McGrath knows that. And
yes.
And there's cycles. I mean, you're not going to get a check in the mail next week, but there are certain parameters that you have to start with. And as I say, we are going to be involved in trying to help the dental community in building up the potential people to work. And the government should be, doing stuff, but
And if there are any viewers that are interested in, Trenton or in South that may be interested in a dental assistant program, they can email me at nicole.mcgrath@kindersmile.org if they're interested in the dental assistant program there.
I'm just putting that in at
KinderSmile.org.
Correct.
Thank
you, Dr. McGrath.
You're welcome.
Thinking about other health centers or other organizations that might want to start a program like this, what do you all think is the most important piece of advice that you'd give to another organization considering starting a dental assistant training program?
To me, it would be to speak to people who have done it already. Most like Zufall. I mean, the fact is that most people want to help other organizations, and just give them a call. As I said, I'd like to say that we're going to be a facilitator of this, but again, I don't know how quickly that's going to happen. I had this dream of big round table with Dr. McGrath and Sam, and different people from the government, and a smaller 10-person thing will help spread it around. But it hasn't happened yet because of COVID and everything else. So we're still on virtual, but I still have that dream that we'll do that.
It will happen.
Yeah, I hope so. They're helping me do it.
I would just piggyback off of Dr. Deblinger too. The first thing is to reach out to those programs that are already in existence and just speak to see their challenges and successes. And just be very organized. I mean, you have to really be organized to make it work for both the organization and the potential dental assistant. You want it to be beneficial for them. You want them to leave feeling empowered and ready to do what they were trained to do. So definitely speaking with other places for the challenges and successes would be a great start.
Mhm.
I think it's really critical to be able to convey the importance of a dental assistant with the leadership at your location. Because there's going to be some setbacks, there's going to be some mistakes, and it's going to cost money. Like if you don't have them on board, it's going to be tricky to do it. And I think it's the leader. You're part of whoever's starting this leadership to kind of set that piece out of how important it is, and making your case with not just how you feel, but what kind of data you can put out there. So look at some of the resources that are available, and I think it's really important to make a good case why you need the help and how much more you can fulfill your mission with this help.
Absolutely.
Please start a committee too. Start a committee. Once you get that initial information, start just a small committee so that everyone has a responsibility, so that you want this to be a success. You want it to be a success. So we have a small committee, and that seems to help out a lot with organization as well.
Absolutely. We've got just about 4 minutes left. So I just want to encourage folks, if there are other questions, to please put them in the Q&A. We can bring them to the panelists. And I'll just remind folks in the chat right now too, we've put the survey for the CE credit. So please make sure that you do that as well. We've talked a little bit about the challenges to setting up the program. What about sustaining the program? We know money, right, is a key issue in sustaining the program. That one never goes away. Are there other things, retaining faculty, what are other issues that you think have been a challenge in sustaining the training program?
I think selecting the right people to teach. You can have someone who's a dental assistant, a dentist, or a hygienist, but they're just not passionate about teaching, or sometimes they're just not really great teachers. They may be great persons, great clinicians, but I think to hold the interest of the students, I think that's the key. Just to be really great teachers, and to be understanding. If sometimes we had a mom who had to bring her child on her knee for Zoom. You can't get upset with that. We're trying to help everyone. So just someone who's, once again, that empathy and great teachers, that's great to sustain the program. And of course, like you said, Shane, money. That's
Dr. Zeckel, any other thoughts, or Dr. Deblinger on that?
I think we're kind of in the middle of the sustaining part. For us, we started with our second cohort. With this program, we've filled all our open positions. So we're considering, we're trying to figure out what the third cohort is going to look like. Or do we take a break? Or do we add on expanded functions? I think those are all components that, it may be all part of sustainability. What are the other things we can do? Okay, we got our staffing grid filled up. Now we need to say, okay, how can we make it more efficient?
And I think that right. And I think further education. Continuing education. I think the question too, it comes up, are we considering this for just purposes of our own staffing up? That certainly I think is probably where it sort of started for a lot of us. But then are we training folks to go out and work at other organizations as well? Or obviously there's going to be turnover. Are you seeing, Dr. Zeckel, less turnover with the folks that you trained yourselves?
We haven't had any turnover recently with the people that we trained. So my fingers are crossed. It continues to be that way. And it's still been it's been a weird couple of years. of us.
We can all agree on that. Dr. McGrath-Barnes, how about for you? For folks that you've trained, your program's been around a bit longer. Have they had longer longevity with you than others?
Absolutely. And it's been a great smooth transition, you know. So yes, those that we've hired from the program, they're still with us, thank God. And a wonderful transition. And those who we didn't hire have gone off to work and are still working at some other dental offices, but not in the community health centers, but more in the private practice and so forth.
That's great. Well, there's certainly a lot of agreement in many of the comments about growth within the organization and workplace culture that really contributes to that. So we are at the end of our time. It is 3:35. I want to just take a moment to thank Dr. Deblinger, Dr. McGrath-Barnes, and Dr. Zeckel. We really appreciate your input. Also, all of our attendees, you brought great questions. I will ask one last one that came in is do you have the trainees sign any agreement to stay for any period of time as part of their acceptance into the program? Dr. Zeckel says yes. Dr. McGrath-Barnes? No.
We don't. We're not into the whole contract. We train you to go out and to be the best that you can, whether you're with us or you're with another organization. That's the basis of who we are, even with our dental providers as well.
So both models can work. Well,
Yes.
Thank you all today. We really appreciate it, and appreciate all the input. And we'll pop back to the lobby and join in the final wrap-up session for the day.
Okay, thank you.
Thank you so much. Thank you, Shay. Thank
Thank
you.
you.
Wishing you
Bye-bye.
guys all the best. Bye-bye.